If you're somebody on your trying to conceive journey with endometriosis, I can relate. While my personal fertility journey is quite complex, I have helped literally hundreds of women get pregnant after years of trying with the exact tips I'm going to be sharing with you in today's video.
Before working with Cindy, my husband and I were trying to conceive for 3 years. We did months and months of ovulatory drugs, 2 failed IUIs, and I had a laparoscopy that confirmed and removed stage 1 endometriosis. Cindy immediately differentiated herself with her availability and the value of her services, but also her expertise and her focus specifically on fertility and endometriosis. 3 months after our meeting implementing those changes, I had the first positive pregnancy test of my life, and we're currently expecting.
We managed to get pregnant naturally, and after a 2.5-year infertility journey, 5 IVF cycles, 4 miscarriages, and an endometriosis surgery, we were in complete shock. But Cindy never gave up on me. She continued to search for answers and possibilities, even after miscarrying following my surgery. I feel so lucky and grateful that we are full term and giving birth to a baby boy in 2.5 weeks.
Hey, welcome back to the Endo Fertility Space channel. I'm Cindy and I'm an endometriosis and fertility specialized dietitian. Please subscribe if you haven't already to get all the endometriosis and fertility specific content. Before I jump into these 8 tips to help you maximize your chances of conceiving with endometriosis, let's briefly talk about how endometriosis affects fertility. I'm a very intentional provider, so I always like to intervene based on what we know. So how does endometriosis affect fertility? We don't have an overly confident understanding of how exactly endometriosis affects fertility. However, this is a brief summary of the info we do have. Pay attention because my tips are based on this info. You've probably heard endometriosis being referred to as an estrogen-dependent condition or an inflammatory condition, but above all else, endometriosis is primarily a condition of immune dysfunction. An autoimmune response is one of the reasons for infertility or subfertility with endometriosis. This autoimmune response is believed to interfere with sperm transport or implantation of an embryo. Additionally, other immune cells like macrophages and leukocytes are produced in higher amounts in and around endometriosis lesions. These immune cells produce other inflammatory chemicals like cytokines and growth promoting chemicals that ultimately contribute to the spread of these endometriosis implants that further contribute to infertility. These immune cells decrease sperm quality and function due to their inflammatory and toxic effects. No doubt inflammation can contribute to infertility or subfertility with endometriosis. In fact, available literature does show that women with endometriosis produce a higher amount of prostaglandins, which can interfere with tubal motility, that's the movement of the fertilized egg through the fallopian tubes into the uterus, and or ovarian function. What's more is that these inflammatory chemicals are found in the peritoneal fluid, which is the fluid that surrounds those important reproductive organs like the ovaries, uterus, and fallopian tubes. Inflammation can also cause abnormal contractions in the muscle layer of the uterus, which can also contribute to impaired transport of a fertilized egg through the fallopian tubes and into the uterus, and with implantation. What about genetics? While the literature on genetics and gene expression is very complex and poorly understood, it has been determined that several genes are expressed in the uterine lining of women with endometriosis. Many of these genes are known to be essential for endometrial receptivity. This means that if the genes are altered, the endometrium, the uterine lining, may not be getting the right signals to allow an embryo to implant. The HOXA10 gene is one of these genes, known to be involved in the development of an embryo in the uterus and in endometrial receptivity. Women with lower levels of expression of this gene have lower implantation rates. Secondary to this conversation on gene expression, the HOXA10 gene is known to respond to changes in estrogen and progesterone levels in the luteal phase. In women with endometriosis, the mid-luteal phase rise is not as would be expected. This partially explains infertility in endometriosis patients. Women with endometriosis have more aromatase activity both in endometriosis implants and the uterine lining, where it is normally absent. Aromatase is an enzyme that converts androstenedione and testosterone into estrone and estradiol. The result of this increased aromatase activity is an increased estradiol production. Higher than normal levels of estrogen is also believed to alter the receptivity of the uterine lining to an embryo. Progesterone receptors and dysregulation of progesterone receptors also appears to play a role in implantation failure. Because progesterone is essential for the necessary changes in the endometrium to sustain a pregnancy and allow for implantation, having healthy progesterone production is crucial for a normal pregnancy. In a healthy, normal individual, progesterone receptors are downregulated prior to implantation, but in the endometrium of endometriosis patients, it's delayed. Lastly, the uterine lining appears to be resistant to progesterone in endometriosis patients, causing an unopposed state, which is less suitable for implantation. Specifically here, I'm talking about unopposed estrogen, which can generate a lot of inflammation. The vaginal microbiome is an often overlooked area where you have a lot of control when it comes to improving fertility outcomes. Literature to date does show that a lactobacillus-dominated flora, especially Lactobacillus crispus, does have a central role to play in fertility outcomes, both with natural conception and assisted reproductive technologies. Escherichia coli, any gram-negative colonization, Streptococcus species, Prevotella, anaerobic bacteria, and Propionibacterium were all associated with infertility, subfertility, or lower implantation rates in the research. Lactobacillus inners strain was underrepresented in cases of unknown infertility. Lactobacillus crispus was more abundant in patients with positive fertility outcomes as well. The endometrial microbiome is also relevant for fertility outcomes. Lactobacillus dominant flora in the uterine microbiome, similarly to the vaginal microbiome, was associated with better fertility outcomes. In this particular review, a lack of lactobacillus dominated flora was considered as an emerging cause of implantation failure and or pregnancy loss. Additionally, in another study in Japanese women, the authors believed that the endometrial microbiome might have been related to unexplained recurrent implantation failure. What about endometritis? Endometritis is inflammation of the uterine lining. Endometritis is more prevalent in the endometriosis population. 52.94% of endometriosis patients were found to have endometritis compared to 27.02% of the non-endometriosis group. It requires a biopsy to diagnose and often presents as asymptomatic, making it an often overlooked cause or contributor of infertility. Research does show, however, that endometritis is associated with infertility and pregnancy loss. 12 to 46% of infertile patients have endometritis. 30% of people with repeated implantation failure were also shown to have endometritis. 28% of unexplained infertility cases were shown to be due to endometritis, and 12% of unexplained recurrent losses were also shown to test positive for endometritis. In addition to immune dysregulation, inflammation, genetics, the vaginal microbiome, endometrial microbiome alterations, and endometritis, nervous system involvement and blood flow also have a role to play in fertility. Progesterone thrives when cortisol is low, and cortisol will not be low when your nervous system is on high alert. Besides having your cortisol levels tested, some other labs that might give you some insight into whether nervous system involvement is part of your infertility picture include these labs in these ranges. Impaired blood flow to the pelvic area is common as well in women with endometriosis and infertility. Additionally, poor blood flow can be a risk factor for endometrioma development, which can lead to reduced egg quality and poor fertility outcomes. Endometriomas can be a cause for the distorted anatomy in the pelvis, contributing to pelvic pain and infertility, but it's possible also that poor blood flow can be a cause of structural concerns like endometriomas that contribute to infertility. This study showed that the surgical removal of endometriomas both improved arterial blood flow and resulted in positive fertility outcomes in endometriosis patients. While not about endometriomas or infertility, literature has identified that left-sided endometriosis is more common. One of the theories as to why has to do with fluid current shown to be weaker and slower on the left side of the pelvis. This allows for more time for adherence of endometriosis cells. While this study doesn't prove anything, it does show that blood flow and the movement of fluid might be implicated implicated in endometriosis and infertility. Speaking of structural concerns like potentially endometriomas on the ovaries, one area in which natural holistic strategies can't help much when it comes to causes of infertility with endometriosis is structural issues. Because the ovaries secrete AMH, anti-Mullerian hormone, any structural blockages or damage on or around the ovaries can reduce egg quality and contribute to infertility. Endometriomas are one example of this. Scar tissue, endometriosis lesions, or inflammation can damage or block fallopian tubes, which can also contribute to infertility with endometriosis. Now that we've talked about some of the causes of infertility or subfertility with endometriosis, what can you do to improve your chances of conceiving and maintaining a healthy pregnancy? So one thing we talked about is this immune dysfunction component in endometriosis patients, which can contribute to infertility. So what is within your control here? Your gut is your largest immune organ. Several studies and several reviews have demonstrated the power of optimizing gut health to optimize immune function. As highlighted in this review, the gut has a strong capacity for immune regulation. This specifically includes downregulating some of the growth promoting factors we discussed earlier as a cause of infertility with endometriosis, and reducing your risk of developing other autoimmune conditions that can contribute to confusion within your immune response. Additionally, short chain fatty acids, which I also like to call postbiotics, the beneficial byproducts of feeding your gut bacteria, regulate host immune responses and enhance anti-inflammatory and anti-proliferative action within the body. This means that having a healthy production of short chain fatty acids can help normalize the immune response, reduce inflammation, and prevent or slow progression of endometriosis. So more specifically, what can you do? If you have digestive symptoms, you need to address them. It's hard for me to tell you exactly what to do, as your digestive symptoms can be any one of 50 issues. In general though, eating a plant-centric diet, meal spacing 3.5 to 4 hours, fasting a minimum of 14 to 16 hours between dinner and breakfast, and avoiding excess amounts of sugar, gluten, and alcohol can only be health promoting and fertility promoting. Your dominant short-chain fatty acid producing bacteria love red foods like pomegranate. They also love green tea, cacao, cranberry, and pycnogenol. Inulin found in green bananas, garlic, onion, chicory, and jicama also feed these keystone bacteria, which are your dominant short-chain fatty acid producers. And fructooligosaccharides is the best prebiotic fiber for boosting your keystone bacteria. I find myself often recommending the Now brand FOS. It's a very inexpensive, accessible brand of fructooligosaccharides fiber. That's something that you might consider. If you have severe or daily digestive discomfort, bloating, acid reflux, constipation, or diarrhea, I highly encourage you to invest in some sort of advanced testing like a GI map stool test or a SIBO test, again, depending on if your symptoms warrant this testing, so you can create a targeted strategy for optimizing your gut health and, by extension, your immune response. Besides targeting the gut specifically, assess other areas of immune dysfunction. If your reaction to gluten warrants a celiac panel, rule this out. Celiac disease is a cause of infertility, and it's more prevalent in women with endometriosis. Look also at your HDL and triglyceride pattern. This pattern in blood work is a sneaky sign of impending autoimmunity. If your HDL is above 70 milligrams per deciliter and your triglycerides are below 70 milligrams per deciliter, this can be indicative of an autoimmune response. Look also at your thyroid peroxidase and thyroglobulin antibodies. These numbers should be as close to 0 as possible. Western medicine has a cutoff for these, somewhere around 30 or 40. However, once your body is producing antibodies, it's tapping into a more sophisticated branch of your immune system. It will only do this if your innate immune system has failed, and this is not good. My 4 favorite ways to intervene on thyroid autoimmunity include gluten removal, gut health optimization, 8 grams of ovasitol daily, and selenium. I would also consider looking at your CBC, your complete blood count. It's more helpful to assess trends, but if you have any abnormalities in your neutrophils, lymphocytes, monocytes, eosinophils, or basophils, this also speaks to an abnormal immune response. or at least that you're getting an immune response. One that I like to pay especially close attention to is eosinophils, as they really only elevate in response to food, environmental allergens, or parasites. If you've ruled out a parasite, or it's unlikely that you may have one, you could also consider a comprehensive IgE allergen panel. It looks something like this. It's a little complex to explain this, but if something in your environment or in the foods that you're consuming is stimulating an immune response, one way to calm that immune response is by avoiding that stimulus. An IgE panel can help you identify this and reduce that response. And an IgE panel specifically is telling you what you're creating an allergic reaction to, not one of those less credible IgG panels. This can have a positive spillover effect into your fertility outcomes. Besides these areas of investigation, you can consider an immunological panel. An immunological panel can point towards either an autoimmune, hormonal, or inflammatory cause for your infertility or subfertility, and it could look something like this. So for example, when the percentage CD19 plus cell CD5 plus is active, this cell line produces antibodies to hormones, hormone receptors, and neurotransmitters. High levels indicate that a patient may respond poorly to stimulation with gonadotropins, and the percentage CD19 almost always elevates in women with an immune cause for infertility or recurrent losses. The second big thing that is within your control to improve is hormone optimization. Like we discussed, hormones play a big role in infertility with endometriosis. It might seem like you don't have a lot of control over progesterone resistance or estrogen production, but you do. My top 3 tips for optimizing progesterone levels include: 1, identify and address any and all stressors. This could include something a bit more obvious like work or personal life stressors, but this could also include physiological stressors: blood sugar dysregulation, skipping meals, living a sedentary lifestyle, nutrient deficiencies, poor sleep quality, GI-related imbalances, small intestinal bacterial overgrowth, an autoimmune condition, inflammation, Epstein-Barr virus. These are all examples of physiological stressors that could be lowering progesterone production. And why might this be happening? Because progesterone thrives when cortisol is low, and any one of these things or a combination of these things could be skyrocketing your cortisol. If your body senses it needs more cortisol, it will push resources to cortisol production at the expense of progesterone. My second tip is a very simple one, and it's to have your prolactin tested. High prolactin is common in endometriosis patients, but typically prolactin really should only increase with suckling at the breast. If you are not pregnant or breastfeeding, you should not have high prolactin. However, high prolactin will still operate similarly in the body as if you were. So specifically, it will block ovulation by suppressing FSH and LH. If you're not ovulating, or if ovulation is weak, because prolactin is too high, you will not have a strong progesterone production on the other side of ovulation. This obviously has implications for your ability to become and remain pregnant. My third tip is to promote blood flow to the ovaries and to ensure all adequate cofactors are being met for optimal progesterone production. These cofactors include B6, omega-3s, B vitamins, zinc, vitamin C, and magnesium. What about estrogen? We've already established that estrogen can be growth promoting and inflammatory. Estrogen is removed from the body in 3 steps. 2 occur in the liver and 1 is excretion through the stools. One thing you absolutely have to do to optimize estrogen levels is to have a daily, complete, satisfying bowel movement. If you are not excreting estrogen through the stools, it will cycle back into your body, potentially contributing to infertility or pain. My second tip is to test. Despite all of these genetic components and the self-sustaining nature of endometriosis lesions and the ability to generate estrogen, there is still a lot within your control for maintaining healthy estrogen levels. There are 2 steps called phase 1 estrogen detoxification and phase 2, otherwise called methylation. The first step relies on the CYP enzyme family. You have a lot of power to influence how effectively these enzymes function to eliminate estrogen. For example, foods like cruciferous vegetables, caffeine, dietary phytoestrogens, rosemary, and flax seeds promote estrogen elimination down the preferred pathway of elimination in the liver. Foods containing synthetic B vitamins, excessive tannin consumption in coffee and or tea, or magnesium or B vitamin deficiencies can contribute to a buildup of estrogen in the second step, which is called methylation. These are just a few examples of how nutrition plays a pretty big role in hormone balance. Back to testing. testing. You can do a standard blood test to understand your estradiol levels better, but a Dutch test is an accurate, comprehensive hormonal panel that also highlights your estrone and estriol levels and tells you how well you're eliminating estrogen in those two aforementioned steps in the liver, all while putting it into context with other hormones. I'll link to some details about completing one of these with me in the notes below. So speaking of other hormones, testosterone and DHA sulfate also play an important role in fertility outcomes. Testosterone is essential for follicular genesis and development, but high levels can also promote inflammation and infertility and are often tied to PCOS. DHA sulfate is important for egg quality, and several studies have shown that it has positive implications for egg quality, embryo quality, and pregnancy rates. Lastly, thyroid dysfunction or thyroid autoimmunity is also implicated in infertility and or subfertility. Thyroid hormones control metabolism in the body. Low thyroid hormone production can cause anovulatory cycles or very low levels of all sex hormones across the board. Going into an in-depth assessment of thyroid function and how to optimize could be a standalone video. So the one action item I will leave you with in this video when it comes to your thyroid is to just have your levels tested. I'm going to share the optimal ranges here for all of the labs in a thyroid panel. What about inflammation? Well, we've already established that inflammation plays a massive role in infertility among endometriosis patients. So it seems logical that reducing body-wide inflammation can have an impactful role in supporting fertility. I want to give you two tips here. The first is to identify where else inflammation may be coming from. Although endometriosis lesions and the inflammatory chemicals that stem from endometriosis are a standalone source of inflammation, by having other contributors to that overall inflammatory load, fuel is just being added to the fire. Here are a few important labs to consider requesting to better understand where else inflammation may be stemming from. And by having this information, you can create a more targeted intervention for reducing your body-wide inflammatory load. My second tip is to work on body-wide inflammation reduction. Some of my favorite ways to reduce body-wide inflammation include prioritizing low heat, high moisture cooking methods for animal proteins specifically. Here I'm referring to things like slow cooking, pressure cooking, poaching, air fryer cooking methods over baking, frying, and grilling. Another favorite tip here is pairing 3 different colors from plant foods with every meal. Golden milk lattes, green tea, fruit and vegetable juices. Avoid smoking, drinking, or drugs. Eat oily fish 3 to 4 times per week, or take a quality omega-3 supplement that's high EPA. Exercise, go to bed before 10 p.m., consider an anti-inflammatory supplement or supplement blend, avoid lonely carbs, so don't just snack on a fruit, pair it with a protein ideally. Practice intermittent fasting, Epsom salt baths, avoid excess processed sugar in the diet, castor oil packs, sauna use, load up your meals with lots of herbs, use olive oil often, get out into nature, garden, and small amounts of tart cherry or pomegranate juice can also help. Optimizing gut and hormone health are major areas of inflammation too, so don't forget those. Based on the medical and surgical practice of NAPRO Technology textbook, you'll find this information on page 565, most endometriosis patients were found to have limited mucus cycle scores and or dry cycles. 67.1% of endometriosis patients were found to have limited mucus cycle scores, and 10.5% had dry cycles. Because cervical mucus is important for helping sperm move through the cervix en route to fertilize an egg during ovulation, it's an important factor in fertility you have control over. If you haven't seen it already, I would pop over to the top recommendations video. I'll link it here. In this video, I go over how to calculate your cervical mucus score. If your score is less than 7.6, then intervening to improve your cervical mucus score can go a long way to improve your chances of conceiving. My top recommendations for improving your cervical mucus score and the quality and abundance of cervical mucus is to firstly hydrate well. No matter what intervention you throw at the problem, you will not be able to improve the quality of your cervical mucus if you're dehydrated. Besides this, application of castor oil packs leading into your fertile window can be very helpful. Evening primrose oil, NAC, Mucinex, and sustained release B6 can all be helpful as well, and I get the best results in this order. So evening primrose oil, 2 grams per day, roughly around 500 milligrams of gamma-linolenic acid. I don't think I've ever had anybody not get great results with that. Acupuncture is another way to improve cervical mucus as well. If you have ever taken an antibiotic, experienced funky smells or vaginal discharge, or you simply want to be checking off all the boxes while pursuing fertility treatments, consider a vaginal swab. This is just part of what a simple report looks like. It breaks down the diversity in your vaginal microbiome, rules out ureaplasma, and depending on the inclusions of the test, can even rule out endometritis without a painful biopsy. Depending on your result, this is information that you can then intervene on. You have a lot of control here. Like I previously mentioned, lactobacillus strains, especially Lactobacillus crispus, gasseri, and jensenii, are especially protective against inflammatory species, infections, yeast overgrowth, and bacterial vaginosis. But more importantly, an abundance of these strains is tied to positive fertility outcomes and live births. I would do the testing over intervening without a result though, as you don't want to be supplementing if you don't need to. Unnecessarily changing your microbiome if it's stable and healthy is not ideal. My favorite probiotics to correct imbalances here include the new vaginal seed probiotic. It specifically includes that Lactobacillus crispus strain. I also really like the Good Clean Love vaginal probiotic and Dr. Mercola Lactobacillus gasseri single strain probiotic. That one, the Dr. Mercola one, is not a vaginal probiotic. So I'll put a couple of instructions in the notes below on how to create your own vaginal probiotic using coconut oil. As we've discussed, poor blood flow is another area of consideration for improving fertility. Some of my favorite ways to promote blood flow is by consuming blood flow promoting foods. These are things like beetroot, oily fish, and watermelon. I also find myself often making recommendations to make nitrate-rich veggie and fruit juices. Caution here if you have blood sugar dysregulation concerns. I'll link some recipes in the notes below. You can also promote blood flow through movement, rebounding, acupuncture, application of heat packs or castor oil packs to the abdomen, or through blood flow promoting supplements like grapeseed extract, L-arginine, omega-3s, or trans-resveratrol. Lastly, very often, one partner can compensate for another partner's subfertility. In the case of endometriosis, consider the male side of the equation and optimize parameters as much as possible. Even if you only improve the male side of the equation by 1%, 5%, 10%, this is absolutely what could move the needle and result in a healthy pregnancy. Consider whether the male side of the equation has high blood pressure, is maybe carrying a little bit too much adipose tissue, has some signs of thyroid dysfunction, iron deficiency, disrupted sleep, high cholesterol, blood sugar dysregulation, or insulin resistance, and or is consuming a pro-inflammatory diet. These are all things you have control over that you can intervene on to improve semen parameters. Other things that are within your control on the male side that have shown to improve semen parameters include wearing loose-fitting boxers and staying out of hot baths or hot tubs. L-carnitine, maca, B vitamins, CoQ10, and L-arginine are all fantastic supplement supports that have a lot of good literature to support their use for improving semen parameters. I personally love L-carnitine and L-arginine for improving motility, and I love CoQ10, B vitamins, maca, other antioxidant vitamins like vitamin C and E for improving morphology. Regular exercise is very important, especially resistance training for boosting testosterone. Acupuncture has some literature to show it's effective for boosting male fertility, and regular structured meals with lots of plant diversity and color. I hope I've given you a lot to consider in today's video. You can access any of the testing I mentioned in today's video inside any one of my coaching programs with me. If you'd like to consider working together, you'll find the link for scheduling a discovery call with me in the notes below. Please don't forget to like and subscribe to my channel. Drop any questions below, and I'll see you in the next video.